Good morning and good afternoon, everybody. We are excited to have everyone in attendance today for our Wednesday webinar. Our topic today is the client administrator sandwich. We're really excited to have Nancy Babbitt with us presenting on this topic. Nancy is a practice transformist, nationally recognized expert and speaker with far-reaching expertise in medical practice operations, governance, and technology. She's passionate about helping practices of all sizes, advocating for physicians and practice administrators, helping them provide quality healthcare in an efficient manner. Nancy is a past chair of the Medical Group Management Association, MGMA, National Board of Directors, and a founding member of the National American Academy of Pediatrics and Pediatric Practice Managers Association. She's a fellow and board certified by the American College of Medical Practice Executives. With that, please let me hand it over to Nancy.
Wow, thank you, Brett. Appreciate that great introduction. And welcome to all of you out there. I hope you don't mind. I'm going to keep my webcam on because I find with webinars, it's easy to get disengaged and go check email or people walk in your office. So hopefully if you have to look at my mug, you might pay a little bit more attention and we'll have some fun today. So I wanted to talk to you today about the clinic administrator sandwich. And the reason why I came up with that title is because I've walked in your shoes. I managed a large pediatric group for 23 years. And prior to that, I was in vascular surgery and did billing for physician-based or hospital-based physicians. So been doing this for about 30 years and been consulting now for about 6. So I know what it's like. You don't really fit in with the physicians. You don't really fit in with the staff. And I kind of always feel like we're the sandwich. We're that person in the middle that has to be the peanut butter or the glue, if you would, that holds everything together every day when we walk in the door. And that's hard to do, not only with the challenges, but think about the challenges we have today. So some of the things that I'm going to touch on are diminished morale, especially with our physician population, consumerism and what I call the changing patient and how we have to deal with that and help our staff be equipped to deal with that. And then I've got some tools for you. So hopefully we can have some fun and you can take a few takeaways today to help you with managing things in your practice and being a good leader to lead through the sandwich that you're stuck in every day. And oh, by the way, you have a box on your screen, the GoToWebinar box. So it's usually, I think, on the right-hand side. And there's a box in there that says questions. So if you have any questions today or comments, please don't wait to the end. Go ahead and put them in there. There's a couple areas where I'm going to ask you for some input too, so we're going to have a little fun, and I'm going to share some of your responses with everybody else that's on the call today. So here we go. We're going to start with a funny because healthcare has become so stressful. I'm sorry, but stress caused by trying to figure out your health insurance is not covered by it. Anybody ever felt like that? So let's talk about the patients that we're seeing nowadays. Through the ACA and just a lot of other changes in our culture and healthcare environment, we have a lot of patients coming in that maybe have not had a lot of regular health care or they don't know about their insurance benefits. Maybe they've never had insurance. So let's talk about this, a typical ACA patient. This is a 33-year-old student. She has some pre-existing conditions. She has a degenerative disc disease. She got addicted to pain medicines when she had a surgery when she was in her young 20s. Now, she's been clean for about 12 years and is going back to school. So she's on the ACA because she needs insurance and is a student. I called her up and I said, I'm giving this presentation and I talk to managers every day and it's so frustrating because we're stuck in the middle, not only in the middle between the doctors and the staff and policies and procedures and regulations and all these other things that just keep coming at us, but now we have patients. And it's our responsibility to train people and for our staff to understand and to be able to explain to patients, because it seems to always fall on us, doesn't it? Who has to explain the benefits? So I called her up and I said, would you mind if I used you as an example? I said, do you know what your premium is? Oh, yeah, she knew her premium. That's $129 a month, which she can afford as a student. So what's your deductible? She said, I don't know. I said, why don't you get your card out and let's look at some things. So she has copays on her office visits of $25, specialist is $35, prescription coverage. She's pretty healthy. She's not really using a lot of this, but she doesn't even understand the difference between a deductible and a copay. So just to set the stage, I know that's what we're dealing with every day, and that's what our staff is dealing with, and it's quite stressful. And then, take a deep breath. We have the gloomy future. And boy, you talk about just kind of like missiles coming at us every day. Does anybody feel overregulated? I think healthcare now is more regulated than the banking industry. And bankers that I know stand up and clap when I say that sometimes in presentations because they're glad that we've taken over for them, although I'm not. Then we've got all this consolidation. We know that the government mismanages things, or they roll out programs and then they change the date, or they delay it, or they change the rules after the fact. Oh, and then by the way, what do? They have racks and things like that, which are basically bounty hunters. They try to send them after us, and anything mistakes they find that we've made, hey, they get to keep a percentage of whatever the government takes back. So, man, the bureaucracy it can be overwhelming. I understand that. And that's why we're going to give you some advice to get some of that paperwork moved from that inbox into that outbox. So let's talk about physician morale. Merritt Hawkins did a survey through their Physician Foundation, and they surveyed over 20,000 physicians. Do you know over 56% said they themselves admitted they have a negative morale? Anybody dealing with that with docs nowadays? It's really sad when I go into practices and a physician will come back from vacation and they don't want to come back to work. It used to be they loved taking care of patients. That was their passion. That's what they got up for every day. And I still work with a lot like that. Don't get me wrong. There's a lot of great docs. But we know we all have those that are they're just beat down. And some of us get beat down with it too. So there's things we have to be aware of on how we can help them that'll help ourselves. Over 50% graded the ACA with a D or an F. Over 85% have implemented EHR. So all those incentives and everything out there, yeah, people are getting on board with EHR, but guess what? 50% feel like it distanced them from their patient care, and 52% have limited access to Medicare patients. Don't even get me started about Medicaid. I mean, it's, the Medicare rules are about 100,000 pages, and I think the IRS rules are about 10,000 pages. How are you not going to make a mistake when you have 100,000 pages of billing rules for CMS? It just gets crazier and crazier. And then don't even talk about macro and MIPS, right? Did everybody get their reporting in about a week and a half ago with the deadline? And unfortunately, 57% said they would not recommend a healthcare career. I don't know what age you are, but I'm of the age. I loved it when I first started working with doctors. They would come from a family of doctors, and they would want their kids to be doctors. And now so many times I work with physicians, and they don't recommend for their kids to go into healthcare, and they would not choose it again themselves. 60% would retire if they could. And what's most discouraging is 82% feel like they're hopeless, like they have no ability to change our healthcare system. Now, we did see a 12% increase in optimism since 2012, and this study was done in 2015. So now it's a little bit older, it's 2 years old, but it's still pretty relevant data. And I think we all see and work with these physicians in our practices every day. The other thing that they found that was a little bit interesting was the more optimistic physicians tended to be younger physicians, female physicians, and employed physicians. So what does that tell us? We're sitting in a group in a private practice with older physicians, maybe male. Are they the ones that are more dissatisfied? Are they less optimistic? Let's think about this. Let's think about the psyche of the physicians that we work with. Physicians are type A. They're perfectionists. They want everything right. And personally, I wouldn't want to work with one that didn't, because you want them to be right. You want it to be done right. They're the doctor. But let's think about our society and our culture and how they're treated. Do you think way back to like Marcus Welby, MD, and some of the shows on TV when doctors first came on, or back in the day, doctors seemed to be the pillars of our community. They were looked up to. We used to say, oh my goodness, they have, everybody looks up to them and does what they say. What's happened over the years? What are the shows now that we see on TV that aren't like Marcus Welby? I mean, what do we have? We have Grey's Anatomy. I want you guys to help me out at this point. So look at your GoToWebinar box and go into that question thing and put in some shows that you watch that you think about nowadays. We have one here in Atlanta it's called Atlanta Plastic Surgery. And I kid you not, I have a friend that manages the actual Atlanta plastic surgery practice. And people see things on TV, like, for example, a butt implant. Who even knew a butt implant was popular nowadays, but apparently it is. But he'll have patients that are on Medicaid calling his office thinking that they can get a butt implant because they saw it on Atlanta Plastic Surgery on a reality show on TV. So I don't know if you guys feel like it. Fill in some questions. I don't see anything coming through yet, but if you'd like to share with me some of the shows that you watch and just how our society looks differently at physicians. I noticed lately there's a Cigna commercial on where it's doctors that have been on TV. So Doogie Howser, and I think one of the doctors off Grey's Anatomy and a couple others. And of course, they're fake doctors, but they, hey, we're fake doctors, but we want you to go get your checkup kind of thing. So it's just kind of interesting and a little bit sad. And I can understand why physicians' morale is going down. It seems like they're getting told how to practice medicine by insurance companies. The government's all over them. Society doesn't look up to them as much anymore. It's not the career that it used to be. So how do we bring that back? How do we build that back up? This is one of my favorite sayings. You can't fix stupid, but you can sedate it. And believe me, there are days where I know we all go through things where we're like, I wish I could sedate a few things out there, but we can't do that. We got to be more practical, right? So how do we reverse that disillusionment? After you finish laughing about my ICU joke, a cartoon there on the side, we can look at the bullets on the left-hand side. So what do physicians like? What gets them motivated? What's going to get back in their heart and in your heart and your staff's heart? Why do you get up every day and come into this practice and do all these extra clicks in the EHR so that you can do your quality measure reporting, or you can report to Cigna whatever new report they want you to report, whatever it is? How do we get that mundane thing out of the way and get back on the focus? I think one thing that docs really like to do is to publicize their clinical excellence, right? So if you are doing those quality measures, or maybe you're doing patient satisfaction surveys, whatever it is, get them to write a paper about it. See if there's a local radio show or TV show where they could go on and talk about something new that you're doing in your practice. And oh, by the way, what a great marketing technique too, right? So whatever it is that you can find that in their heart is going to get them excited again about coming in and taking care of that patient and maybe sharing that information. Maybe it's a round table at the hospital or something like that. But I think if you can bring it back to that patient care and why we're here every day and get that focus on that satisfaction that we get from the excellent care that we provide. And we have to keep talking about that because we hear so much negative every day. I used to feel sometimes like I was the nail on the head when I would come into work every day and I'd have my list of everything that I wanted to do. But here I was, this little nail on the head, and it was like a hammer, just boom, boom, boom. And I'd hear my name, Nancy, 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 Nancy. I need this, I need that, I need this. Physicians come in, they all have great ideas, and you don't want to disillusion them. You want to keep those ideas coming. But hey, guess what? Our plate is full. We probably already have a full-time job and things to do. So I kind of always like to put a whiteboard up on the wall, and I'd like to have my current projects, things that we've all agreed on, that I'm working on, that we're doing in addition to everything else that I'm doing, like payroll and all my normal job responsibilities. And then if people come in and they have great ideas, or there's something you think might motivate the staff, have a place on that whiteboard for ideas or things to discuss in the future. And make sure that you keep those ideas up there and you get back to people to put them up there, and you follow up and you're transparent and you say, hey, we discussed that idea. We can't do it right now, or it's not in the budget, or it's a great idea. We're going to do it, but we're going to do it in the second quarter of next year. This is our goal. Whatever it is, you are the one, you are the glue, you are the sandwich that has to figure out, okay, how do I get this spirit back in these people? I don't know that you can really motivate somebody or that you can change the morale, but I think you can do little things every day that build that trust and that respect, and you can be that sandwich that brings everything together to focus on what's important in the day in the practice and not get sidetracked by the ugly patient that threw a fit at the front desk because, oh my gosh, you asked for their copay. I mean, I know those things happen and people have meltdowns, and what happens is, it snowballs sometimes, and that's all the staff wants to talk about, or somebody made a mistake in the back and a patient got upset, and it just kind of like that's all anybody wants to talk about. You have to be the one that brings it back and brings that focus. Step up and be that leader. Some important things that I don't see a lot are patient education, and this sounds pretty basic, but we know patients nowadays. They will come in with a list like this off the internet, or they bring their mother-in-law or their whoever, they found on the internet or down the street with them and have all these questions. So I find that if you can have good education prepared ahead of time for common things, on your website, have reliable links of where they should go. Don't let them just go Google something and go to some site that somebody built their own page and it's not reliable. Send them places that you know that is reliable information and that it matches the reliable information that you're going to give them in the office is that patient education. That is critical with patients nowadays, and also really helps with that relationship between the physicians and the patients and just keeping everybody happy. The other thing that I really like with physicians is books. So I'm a big reader. If you have a physician that's a big reader and you want to direct them in some ways, I've got some books up here on the screen for you. One of my favorites is called Unaccountable. It's written by a physician, so it's very physician to physician. I think they get it, and it really talks about transparency and, kind of what the evolution of our healthcare system's been, in his opinion, and how to revolutionize it. There's another one, An American Sickness, how healthcare became a business and how to take it back, how you can take it back. And then this is one that Dr. Haley Fisher Wright, who is the president and CEO of MGMA, Medical Group Management Association, recently wrote. It's called Back to Balance, and it's a very good book about physicians and how they can get back to the art and science and business of medicine, because it is a business. But I think, unfortunately, the art and the science sometimes has been left out recently, and I really think that's what physicians miss. There's another book that I've read recently that I wanted to share with you it's really good. It's called Necessary Endings. I don't know if you've heard of it. I can't remember the author's name right now, but if you Google it, it'll come up. He also has a cool Facebook page and talks about how sometimes you just need to end some things. So physicians, managers, we're all that kind of type A personality, and we kind of tend to just keep taking on more and more and more, and especially with what our complicated healthcare system keeps throwing at us nowadays. So sometimes it's necessary to stop things. A good dear friend of mine has a stop it button, and I mean, it's like the stop it button, and it says stop it, and she keeps it on her desk because so many times we just keep adding, but we don't think, what do we need to stop? What can we take out of our life? When's the last time you went around your practice and just spent a few minutes with everybody and asked them, is there anything that you're doing? Are you doing something just to do it and you don't know the reason why? Are you creating a spreadsheet? Are you printing out stuff out of the schedule that we don't really need? Are you clicking something in the template and nobody knows why we click that in the template? So there's a lot of little things like that I think beat us down and beat down that morale every day. And if you can get people excited about reading, maybe do a book club, maybe talk about what in your practice, how can you get them engaged to change your practice and start with your practice and make your practice better. So just some ideas for you. Okay, how many people count on their kids to explain a new cell phone or their new laptop for them? I have a 7-year-old grandbaby, and I can tell you she can show me things on the iPad that I did not even know were there. Oh, I forgot to ask you on the last slide. Same thing, if you would go into that question box, and I didn't get any on the videos or the shows, but if you guys have any good books that you'd like to share with others, go ahead and put it in the question box, and I'd be glad to share it with other people before we get off the webinar today. So again, you go to your box on the GoToWebinar screen and open that question. the drop-down thing, and you can just key in there, send to me or send to all your question, and we can see if you have any books that you'd like to recommend for others to read. All right, so let's talk about challenges that we have with patients. We have high deductibles. I also am on the ACA, just to let you know, and I just am getting over a fractured wrist. So you can see I talk a lot with my hands. I call this hand kind of my mannequin hand, though, because I'm still in physical therapy and I can't quite bend my wrist and do everything yet. It's been a couple months since my surgery, but I have a $5,000 deductible, and I've been on an ACA plan now for a while, and this is the first year I've met that high deductible because $5,000, wow, that's a lot. Of course, if you have surgery, you're going to meet it. You know, we're getting a lot of patients with some really complicated medical issues. And then we also have the whole issue with the subsidized premiums, right? Has anybody been caught in that little trap? A lot of my clients have. The other thing about the new marketplace is we're dealing with a lot of commoditization, consumer-driven plans, and just insurance-driven healthcare. And I know we've all dealt with this for years, but it just seems like it should be getting better, and it's not. It's really not. For example, I have an associate who manages a neurology practice, and when they want to send somebody for a brain MRI, they have certain MRIs that have stronger magnets and have the detail that they need for a neurologist to see, who, by the way, may be going in or sending you to a neurosurgeon to have brain surgery. So yeah, you kind of want the most accurate MRI you can get. Well, what they found out with one of the big carriers here in town was, guess what? They'd see a patient, they'd send them for the order. You need an MRI, you need to go to one of these locations with this type of MRI. The insurance company would send them a letter and then call them and say, no, you have to go to our place down the street because it's a lot cheaper, or you have to pay the difference. So what do? I mean, you're really in the sandwich there, right? Because you've got a patient who may go down the street and get the cheaper one, but then when they come back into practice, your doc's going to say, hey, I can't, this doesn't tell me what I need, and it's just, okay, it was causing problems. So what do? We have to be proactive. Now, when we order an MRI, we have to give a nice little letter to all the patients that explains why they need to go to this one, and they may be contacted by their insurance company to go to a different one. If they need help getting a prior authorization, oh, by the way, who has to do the work? Us at our office to get it approved if we can, and we may not even be able to. And then we have to explain to the patient why they have to go to the more expensive one. So these are really, really important things. Here in Atlanta, we're having a dispute between the 900-pound gorilla insurance carrier in our state and one of our large healthcare systems in town, and then they have hospitals and tentacles and practices throughout the city. So a lot of patients are affected. Their contract with this major carrier was up March 31st. The governor got involved a couple days after March 31st. Now, one of my clients happens to be a surgery practice, so we have patients that might have been scheduled for surgery right after March 31st that were on this plan that we were having to notify, patients who were coming for post-op, patients that had been seeing us that needed to come back for follow-up because some of these patients were cancer patients. So just all kinds of high-stress situations with patients that really wanted to stay, obviously, with the same surgeon that they had started with. But we had to do the extra work. They had continuity of care forms that had to be filled out for the claims to continue to be paid inpatient, and having to call the patients and explain everything's on the schedule that's coming up after March 30th. You guys know the rigmarole. Well, the governor of our state got involved and said, oh no, we're not going through this again, because about 2 years ago, this happened with the same hospital system and another carrier, and it took about 45 days after the termination date before they settled. And so we had seen patients for 45 days, charged them out-of-network benefits, filed the claims, got paid as out-of-network. What happened? Oh, they settled and made a deal and retroed it back to the termination date. So guess who had to do all the work of refiling all those claims and refunding patients who had paid out-of-network amounts to their in-network amounts? So It is really just a challenge nowadays, and you have to stay proactive. You have to know what patients are coming in asking. Who remembers when you used to be able to train a front desk person in like 2 weeks, right? Okay, you could tell them like, okay, here's the schedule. This is how the doctor likes it. Da, da, da. Now it's like 6 months, and that's if they've come from somewhere where they have some insurance knowledge, because you really have to explain, and they have to know a lot about insurance benefits, even on the front desk nowadays. Okay, that was a lot of information, so we're going to take a little break here and do a little study. Your medical diagnosis options by a doctor, pros, free magazines, mostly accurate, cons, hard to get an appointment, wildly expensive. By yourself on the internet, pros, convenient and expensive, cons, oh my God, I'm going to die, right? People on the internet. All right, another trend we see, of course, is doctor shopping and doctor hopping and price shopping. Transparency is a good thing, and I'm all for it, but patients are becoming much more demanding, especially the ones with these high deductibles that are paying out of their pockets. They want to know what it costs. They have a lot more questions nowadays, right? So let's give some tools. Take a deep breath. I'm going to take a deep breath and get a glass of water here and take a sip if you'd like to do the same. I'm not going to keep y'all too much longer. We've got a few more slides on tools, and we'll get finished up. So if y'all have any questions or anything you'd like to share with us, be sure and go to that box on your GoToWebinar screen and share that with us. So let's talk about training staff. What are the main things that they need to know? Do they need to know everything? No. But even to check eligibility, they've got to know plan benefits. They've got to know the CPT codes that you're going to bill, right? Are you guys using forms? Do you have a standard form that you've set up for them so that they can go through all this? Do you have a financial policy? And where is your financial policy? I've really encouraged people to start putting their financial policy on their billing statements, which is kind of unheard of and sometimes hard to do, but it's pretty important. Insurance verification at each visit. I cannot tell you how many times I go into a practice and they are not doing that. And that is just low-hanging fruit. You've got to do that every time on every patient. The ACA patients, your staff needs to understand that. And I've got some information coming up, some tools on that, just specifically for the ACA patients. So hopefully you will get caught in that that policy period, or that period where they can have a grace period on their premiums. And the most important thing I think now to do is to really screen our patients before scheduling. So every practice I go into, I ask, okay, if someone calls to schedule a new patient appointment, where's your script? What do you have? And they're like, what do you mean? I'm like, well, if I wouldn't ask that person and that person and that person what they asked before they scheduled a new patient, would it be the same? Oh yeah, it never is. I encourage you, script as much as you can. People are not born with these skills. I wasn't born with these skills. Yeah, after 30 plus years in healthcare, I understand a lot of the lingo and a lot of it, but let's face it, some of these people on the front desk, they need some help. And if it's not a script, at least just a check box before new patients. What insurance are you on? Do we accept your insurance? Have you checked with your insurance to make sure you've met your deductible? Start that relationship with that patient with a nice tone, with great customer service, but also with the expectation that they need to know their benefits before they come in. This is a mutual relationship that they need to understand too. What should your financial policy include? A lot of times, it's pretty basic, but don't forget some things that I see left out. And those are my top 2 right up there: an abuse and grace period policy. So I have one for you in writing, so don't worry. So, you're going to have all your typical stuff, but these things are a little bit unusual. I don't see them that often, so I really would encourage you to take a look at that financial policy. Keep it short, keep it simple, keep it easy. If you have insurance, this is what happened. If you don't have insurance, this is what happened, and a few other little things. And then where are you putting your financial policy? Is it on your website? More often than not, I see all this clinical stuff and a lot of it, your HIPAA stuff and all of that, but I'm not seeing your financial policy. That should be front and center. Again, you want to set that tone it is a business relationship. And yeah, they may have insurance, but it's a financial policy between them and the practice. Is it in your welcome packet that you hand out? Is it in your brochure? I mentioned the billing statements. And make sure you update it and read it every now and then. So this is a great thing from the American Medical Association. If you Google the AMA example grace period policy, you'll come up with a whole toolkit that they did for the ACA, the AMA and ACA. Well, you know, healthcare and acronyms, got to get those right. But what this basically says, and you can read it, is that if they don't pay their premiums, they agree to be responsible for the bill. Because we know there's that grace period with the ACA. They cannot pay their premium for up to 90 days. So you may be getting claims paid and thinking, oh, this is great. They have insurance. And all of a sudden it retros back because they haven't paid their premium, and they'll take those payments back. So definitely make sure you have this sentence in your financial policy. Like I said, if you want to Google that AMA policy, and they can help you with that and some other tidbits. So now we're coming to just a sample abuse policy. Oh, I've got a question. Can we get a copy of these slides? Of course. I will be glad to give these to Brent, and he can send them out to all of the attendees after we finish, so you guys can have these tools and use them. I think it's so important with staff. I mean, I know most of the doctors know that we work with. They know that we have our back, that we have their back, but our staff, I don't think, always knows that we have their back. And if we want to be a leader and we want someone to follow us, it's about building that trust and respect and getting them to follow us. And this one thing here is huge, 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 especially in today's environment with some people, those one or two that are just going to ruin your day. It's like, hey, we have a policy. This happened to be from a pediatric practice that I was helping. So it's a patient-parent abuse policy, but you can easily adapt it for your practice. But just a couple simple statements about, you know, how patients are expected to treat us and our staff with respect. And if they don't, we have a written policy. So this is something, it's just a simple tool, but again, it's a policy that we can fall back on. And if someone is rude to our staff or our physicians, you know, it lets them know we have our back. And if we need to, we can discharge them. So, proof of insurance. This is pretty important. I know some practices that have really gotten burnt by these ACA plans with a grace period. So they will actually, you know, have a cancellation policy. They'll say, I want you to show me where you paid your premium. Bring me the receipt. Show me the canceled check, whatever it is. And you know, you got to be careful that you don't do patient abandonment. There's proper ways, but if it's something that's non-urgent or a well visit or something like that, if they can't prove that their insurance is active, you know, it's okay to have something in writing to say, we're going to reschedule this policy until you can prove that you're either going to pay this or that you have insurance. Of course, collect up front, collect up front, collect up front, collect up front. I think we've all said that 1,000 times. And most practices are pretty good about that. Have you thought about a credit card on file? There's actually some practice management companies now that are out there offering to store secure cards. And when the payment comes back, you can automatically have permission from your patient to go ahead and just post the remainder or their portion of the balance due on their credit card. There's companies that will handle that for you. I wouldn't encourage you doing it in your office because there's just so much fraud and abuse out there. But, you know, if you have a secure way to keep a credit card on file and your patients give you permission to do it, I am seeing it more and more now. And then, of course, consumer finance options. So there are a few credit card companies out there that will help our patients get some financing, sometimes some banks and things like that. OMG, doctor, where's the umbilical cord? Wireless technology stuff. You gotta love it. Technology. There's days you can't live with it and days you can't live without it, right? So grace period patients, you know, here's a lot of things, just options. Some things I've seen are illegal, so we'll go through a few of these. You know, obviously you're going to check their eligibility. Insurance companies can pen the claims. So if they've had a problem collecting premiums, I do see a lot of them that'll pen claims, and you'll see codes on there. I have seen a few recoupments. A lot of them will track grace periods. So there can be codes on there that you can get to know when you go and do your eligibility check. Oh, this is an ACA patient. Oh, here's another code about a grace period. Now, there have been some practices, some physicians, out of the goodness of their heart, that felt, well, I have a patient who's had a really bad diagnosis. They're on an ACA plan, but they can't pay their premiums anymore because they can't work. Well, how can we help them? Unfortunately, it's illegal. You cannot help a patient pay their premiums so that you can get paid through their insurance company. So unfortunately, do not do that. You can reschedule appointments, like I said, depending. I can tell you, being on the ACA, if you're a couple days late on your premium, you get a letter, you get phone calls. They notify the patient that they're in their grace period and that they're behind on their premium, and they will rescind coverage if it's not paid. And bottom line, review your contract, because a lot of us signed contracts years and years ago, and now we've got a carrier that's on an ACA plan, and so things are different. Fee schedule might be different. A lot of things could be different. So make sure you review that contract, and sometimes you need to try to go back and maybe renegotiate a few of those things. All right, another funny. You have 8 facial piercings, nipple rings, and tattoos covering 75% of your body. You do not get to cry when I state that I'm here to start your IV. Although IVs do kind of hurt, I have to say. So back to the ACA patient that we started with, the 33-year-old. I wanted to let you know this is a picture of her. She's my daughter. She's the one on the left, her wife on the right, and my 7-year-old grandbaby's in the middle, who I think is just the cutest ever. But it just brings home who these patients are. And even though they may not know their benefits and they may not understand everything, it's just so inspiring what we do every day. And it's so important that when we get out of bed every morning, we find out, what is that in our heart? How can we instill that satisfaction and get people excited about coming to work and taking care of patients? One of my favorite sayings is, especially when everybody's crazy, we've just had a complaint or a meltdown or something bad just happened in the practice and everybody's a little bit skittish or upset, I always say, look, it's okay. Let's just remember why we're here. We are here to serve the patients. We are here to serve the providers, and we are here to serve each other. And if we just remember that and remember our priorities, we'll get through the day. We always get done and finish up. Some days we may run over a little bit, but we do get done, right? It does get done through the day. So thank you for what you do and what you get up every day and share with your patients and your staff and physicians who morale we know has been diminished and probably is on a trend to continue if our healthcare system doesn't change in the near future. So I wanted to leave you with a little note. I have what I call my kick butt angel sitting right here with me to help me with my webinar today, but also just to share with you, when I was going through my second EHR implementation at the pediatric practice I was at for 23 years, my staff gave this to me, and they were like, Nancy, we know you can do this. Here's a kick butt angel to help you. And it says on the back, you've got the power. So don't forget, every day you have the power. You're a leader. You can come in every day and make a difference and make a change in these people's lives. And everything you do, every little thing you do builds trust. Every time you say and do what you say you're going to do, that builds that rapport with the staff, and you're going to be that leader that they want to follow, that clinic administrator sandwich. All right, I'm going to leave you with some advice. If you can't afford a doctor, go to an airport. You'll get a free x-ray and a breast exam, and hey, if you mention Al-Qaeda, you'll get a free colonoscopy. So thank you so much for your time today. Brent, I'm going to turn it back over to you for some final thoughts. And don't forget to unmute your phone.
Thank you so much, Nancy. We really appreciate your presentation today on today's topic. I'm sure everyone got a ton of information out of today's presentation. If you'd like to look and review the presentation, again, we will be circulating the slides, as well as you can go to our YouTube site at our channel for Triarch Health. Just type that in the search bar, or go to triarchhealth.com and we will broadcast the replay of today's webinar as well. If you do have any questions regarding any of the information or how Triarch can help you, assist you with today's topic, please feel free to reach out to our support team or your territory manager. Also, remember that we have another Wednesday webinar coming up next month with Nancy again, so look for an invite from us as well as going to our triarchhealth.com website to sign up for next month's webinar. Again, we're very excited to have everyone here with us today. Thank you again, Nancy, for presenting on today's topic, and if you have any questions, feel free to reach out to us. We are here to help. Thank you, and have a wonderful month, and we'll talk to you again. Bye.